morning, Sunrisers. I'm Dr. Karen Emerson, and today I have with me my technician Annabeth, and this beautiful little husky right here is Gunny. Now, a few months ago, Gunny presented basically totally lifeless. Her dad had to basically carry her in. Her extremities were extremely cold. She had been attacked actually by a pack of coyotes. She had probably over 30 multiple bite wounds, which we are going to show you some pictures of. She had them, her ears were torn. She had multiple bite wounds all over her neck, basically around her tail area. There were big rips. All her legs were chewed. One leg had probably about 15 different types of wounds going up and down the leg. Basically, she was comatose. We placed a catheter. We started emergency measures, and we actually started getting her back. She actually ended up having about 3 or 4 surgical procedures performed, and now, as you can see, she doesn't act like that at all. Basically, what I want to come across is when you have a dog and you live out in an area that maybe is a wooded area, there is a huge possibility that coyotes are there, or maybe other stray dogs that are wandering. And of course, she was a lot smaller then, and when you have a pack mentality of dogs that decide to attack, they will try to kill your pet. She actually had a large laceration in her neck that exposed her jugular vein that we had to go in and clean. I mean, it was a very, very difficult case, but through a lot of attention and love and care and a lot of intensive hard work from my staff and I, we brought her through it. And it's actually basically a miracle story that she survived it. So this is one picture of her neck. Of course, this is several days after surgery. This is another picture of just some of the wounds. These areas are all multiple bite wounds, and they continue down her entire body and along her legs. These are actually drain tubes that we had to put in because you can't just immediately sew up a bite wound because of infection. So these were allowed to drain. So she had these drains in her necks for probably about 10 days, and she stayed in hospital for about 2 weeks. So this was extremely painful and extremely traumatic for her to go through, but you can see how well she's recovered. It's so important that if your dog does get attacked, to bring them immediately in to your veterinarian. They can go into something called hypovolemic shock from losing a lot of blood, and she had lost copious amounts of blood. She was covered in blood from head to toe. So basically, we got her stabilized. I did not do surgery that day. We did surgery the next day, and we did surgeries following those days, and she survived. I mean, you would be shocked at, just like in people, the miracles that can occur if you get them to the vet on time and they get that special care they need. And don't give up. So if you have a pet that's been attacked, or you live in a big area that's not fenced in, that maybe you have the possibility of other dogs coming in, it's probably a good idea to maybe fence in your yard or do some sort of wireless barrier so that your pet can't wander off and a possibility of it getting attacked. She thanks her parents every day.
WCBI Animal Health with Dr. Emerson was brought to you by Emerson Animal Hospital in West Point.